Radiation therapy is a highly targeted way to destroy breast cancer cells. Dr. Ram Rao, a radiation oncologist at Pomona Valley Hospital Medical Center, outlines the effectiveness of this therapy for fighting breast cancer.
By treating the breast cancer with the radiation, the patient or the woman can avoid going through mastectomy, which is removal of the whole breast. That's the main advantage. This has been done for 30 plus years. The surgeon removes the lump or the cancer. So many women choose to have this rather than having the breast removed. It to be beyond any doubt as good as removing the whole breast or mastectomy. So many women choose to have this rather than having the breast removed.
The newest radiation techniques precisely target the radiation dose.
Recently, there are some newer things called accelerated partial breast radiation. The reason that we treat only part of the breast, not the whole breast, is that 80+% of the time, if there is a recurrence after radiation, it's mostly at the previous tumor site called lumpectomy site. And because the volume of the treatment is limited, it can be done in a shorter course, like over 1 week time instead of 6 weeks. That's a little bit more involved and invasive. The surgeon usually puts in a catheter into the site where the lump was removed. It's called lumpectomy cavity. And we do CT scans of that. We use computers to figure out how to limit the dose to the part of the breast and not treat the whole breast. And we didn't have that like 10, 15 years ago.
During the treatments and after, patients have less severe reactions than in the past.
Some of the side effects are feeling tired, irritation of the skin of the breast where we are treating, and tenderness in the breast. We usually resolve within 1 month after the treatments are done. During the actual treatment, which takes about maybe 3 or 4 minutes, they don't have any pain. It's like getting an X-ray done. They don't have any pain. They don't lose hair.
Radiation treatments are found to be as effective as mastectomy.
The recurrence rate after the radiation is very low, like less than 5% in stage 1, stage 2 patients where we treat them. That's comparable to those that went through mastectomy. And in fact, many times patients, if the lymph nodes are positive, the patient has to go through radiation even after the mastectomy.
Technology has made the targeting extremely precise.
Now we plan radiation by planning on the patient with a CT scan. We look at the organ at risk, that's the breast. We look at in 3 dimensions and then plan the radiation. The dose is confined to the breast, and the tissue around like the lungs, the heart get minimal dose. So that's a significant advantage. Dosimetry has improved significantly. How we figure out how to deliver the dose of radiation to the breast. The computer technology has evolved so well.
A one-time radiation dose at the time of lumpectomy is becoming the future of treatment.
I see the future where the radiation treatment in very selective group of most of the time the patients have early stage cancer because of the mammograms and all the promotion, all the awareness among the women. So early stage diagnosis, so they get the lump removed and the radiation given right in the operating room, 1 shot. That's called intraoperative radiation. It's happening now, and I believe it will happen in the near future. That's more convenient for the patient.